So dementia with Lewy bodies, I think, is now well recognised as the second most common cause of dementia after Alzheimer's disease. For a lot of years it's been thought to be rather difficult to diagnose and even more difficult to manage and treat. But we're making good progress. We now are fairly confident there are about 5 million people in the world with DLB. It's not an uncommon disorder. We've very recently published a new set of diagnostic guidelines which should make it easier for clinicians to diagnose the condition. I think previously it's been a diagnosis that's been made in specialist clinics, and it's important that we make it recognisable for generalists as well. So the experience of people with DLB and their families is it often takes 2 or 3 years to get a diagnosis, and that's a long delay in an illness where people are deteriorating slowly with time. So we first published diagnostic guidelines for dementia with Lewy bodies in 1996. We renewed them in 2005 and we refreshed them again in 2017. And the improvements in the new guidelines are essentially, it's evolution, not revolution. We've tried to simplify by having a clear distinction between clinical features and biomarkers, something that was rather blurred previously. So we have a set of 4 core clinical features, which are fluctuating cognitive impairment, visual hallucinations, Parkinsonism, and REM sleep behaviour disorder. So these are 4 clinical symptoms that clinicians can quite easily recognise. We then have a series of indicative biomarkers, so these are strong support for the diagnosis, and then some supportive biomarkers, which are signposts, if you like, to the diagnosis, but not as strong. So we hope that on balance that's going to be useful to the clinical community.